give or take. Now, he also says that he's feeling really good. Don't be afraid of COVID, he says. Don't let it dominate your life. We have developed, under the Trump administration, some really great drugs and knowledge. I feel better than I did 20 years ago. Well, we are expecting any minute now an update from the doctor to President Trump. Well, his team of doctors, of course. They have been trailing that they will be coming outside. There we can see the microphones are ready. We have been hearing, to be fair, for a while that they are going to come out and deliver an update. And I suppose Donald Trump has, well, trumped them with the news that he will leave. That would have been their main announcement, I presume. But Donald Trump has made that announcement himself, which will be welcomed by many, not just in the US, of course, but around the world. The president be able to leave and head back to the White House. But several questions still remain about the treatment that he received and about his overall health. And those are the questions that we hope will be answered by his medical team outside the hospital there. Right, Lebo Diseko is also outside the hospital, and we can speak to her now. Lebo, so Donald Trump tweeting out the news that he is leaving.
Yeah, I think you're right. He did rather trump the announcement or the briefing from his own team. I mean, if we thought that Donald Trump was maybe going to take a different tone, I think his tweets this afternoon has shown that he is perhaps digging in terms of his approach to coronavirus. When he tweeted a video yesterday, he said he'd learned a lot of things and he'd learned them in the real way. He hadn't learned them from books. He had really gone through the experience. And he said that he had really learned from that. Today he tweeted saying, don't let coronavirus dominate your life. We've got some really great drugs under the Trump administration. And he said that he feels better than he did 20 years ago. Now, it is worth reminding people that there are currently in excess of 7 million cases in the United States and almost 200, well, more than 200,000 deaths. So that is something that's worth taking on board as well.
Lebo, well done for fighting against the traffic and the crowds there. I suppose that's actually quite revealing, though, because, of course, there have been people there all weekend. We've been watching them gather. But now, with that news, that will really buoy up those supporters.
Do you know what? Most of the supporters have been very, very good-natured. This afternoon we do have a gentleman next to us that's a little more noisy than what we'd experienced at the weekend. So I was doing my best to concentrate. But yeah, there really is a tremendous outpouring for Donald Trump here. And he acknowledged that in one of his tweets. He said that the media had been criticizing him for his drive past his supporters yesterday. You'll remember he came out in a car with his staff. They were wearing masks, he was wearing masks, they were masked as well. But lots of people said, look, that may not be the most sensible thing to do when one has coronavirus, and also that vehicle as well is designed not to let in any kind of, chemical or biological attack. So what does that mean in terms of airing? I mean, how do you keep somebody safe from a patient with coronavirus in a container like that? But Donald Trump digging in, saying that it's reported the media's upset because I got into a secure vehicle to say thank you to many fans and supporters standing outside the hospital. If I didn't pay my respects, the media would call me rude. So, this really does seem more like the Trump that we are used to seeing and hearing from on Twitter.
Yeah, and interestingly, of course, although he has his problems with the media, especially in the US, it was more doctors, wasn't it, who were expressing their alarm. In fact, one doctor from inside the hospital itself expressing their alarm with that little trip. But anyway, that aside, what questions do we now still need answering, Lebo, about his condition and about the treatment and about the timeline here?
Well, I don't think those people behind me have any questions, but many Americans will be asking really about the inconsistencies that came out from the president's team over the weekend. There were questions raised about the timeline, when exactly he was diagnosed with coronavirus. Also, how sick he actually was. His doctors went into quite a lot of detail about the fact that Donald Trump was given oxygen on Friday, but then when pushed as to whether he'd received oxygen when his levels dropped on Saturday, they said, oh, you have to ask the nurses. We'll have to ask the nurses about that, which seems incredible from his personal physicians. So yeah, there are a lot of questions to be asked. Also, there are people questioning whether the type of treatment that he has been receiving matches the kind of more mild symptoms that his team seem very keen to put forward that he has. I mean, they are really saying that he was taken into hospital out of an abundance of caution. But there are many people, commentators on lots of shows, some of them are medical commentators, saying that the type of treatment he's receiving doesn't quite match that. So yeah, we'll hope that we'll be given quite a bit more clarity, if nothing else, a consistent message from them and the White House. You remember on Saturday there was also inconsistencies between the message from the team and the White House Chief of Staff.
Okay, thanks for that, Lebo. We'll be straight back with you as soon as those doctors march outside the hospital there and give us that.